Hi class, this is Colleen. I'm going to be talking about interprofessional collaboration, and let's get started. Maybe. What is interprofessional collaboration? Interprofessional collaboration is when there are two or more professionals have a common goal. And these professionals share responsibility of improving something. They all have the same goal and they want to improve something. It's very important in healthcare for patients' quality of care. So we want to work together. We don't want to be like these two where one has the outlet and the other has the cord and no one talks to each other, so things get missed. And that is not what we want to have happen. The World Health Organization states that with interprofessional collaboration there are better family health, infectious disease, humanitarian efforts, response to epidemics, and non-communicable disease outcomes. And this is why it's so important for all professions to be able to talk together and to collaborate. 3 significant healthcare concerns where there is a need for interprofessional collaboration. The first one I'm going to talk about is providing patient-centered care. The 21st century focuses on patient-centered care. Before, it was where the providers would all discuss the plan of care with the patient. Now it is including the patient and the family and all healthcare disciplines. This includes the nurses, the nurse practitioner, the social worker. As an educator, it's very important to educate the new students and the staff of interdisciplinary collaboration. And also, it's important as an educator for students to do some role playing with them to encourage them to communicate with the other health team members. And it builds their confidence, and that is huge, and that's very important because you don't want to be a nurse on a unit knowing something is not right and not speaking out against it. It is very important to build that confidence in students. Working together is to improve the overall care to the patients. Another aspect, healthcare concern, is collaborative research. This is very important. This is how we get all of our science and technology working together. The problems that exist cannot be done alone. We need to work together to research and define the answers to improve the quality of care of patients. As an educator, it is our role to educate the students and staff of the importance of working together as a team to perform research. Working together can build on current knowledge and encourage different ways of thinking to find a new solution. It's thinking outside of the box. Working together, one person might have some idea and another person might have another idea. Everyone brings good things to the table. As an educator, it is also our role to educate the students on how to research. How do you utilize the resources that are available to us? How to look online to make sure you're looking at current articles and good articles. And also to delegate. A lot of times I know for myself, I want to take it all on, and it is so important to delegate. There are other people that can help us out. In the hospitals, you can utilize the librarians. There's actually research nurses there. There's a lot of resources available. So working together basically for the same outcome. Another focus that's happening in the 21st century is ambulatory care. So now we're having patients leaving the hospital sooner and the care is being taken care at the home. This is a huge collaboration amongst the primary care physicians, the hospital doctors, the nurse practitioners, the pharmacists, social worker, home care nurses. This is very important. As an educator, we need to educate students on how to utilize these resources. Another factor is the electronic medical records. This is a great resource for all that are involved with the patient that's at home, and also telecommunication. We can utilize the computers, and there's so much out there now that we can do for patients at home. All right. My proposed evidence-based change is actually interdisciplinary rounding on the palliative hospice unit strong. The reason why I wanted to change this is the current practice is that they do round, and they've tried to have interdisciplinary rounds, but the providers start rounding at different times. The nurse is not aware when they're rounding, so the nurse has not been always included in the interdisciplinary rounding, the bedside rounding. So my proposed evidence-based is the implementation of interdisciplinary rounding, a standardized guideline for the unit to go to the bedside with the provider, the nurse practitioner, the social worker, the charge nurse, and the nurse that is taking care of the patient. This is to improve the efficiency and effectiveness of care of the patients, to improve patient satisfaction, and it increases staff satisfaction. The role of the nurse as a leader for success for my change. The nurse has a huge role in this change. I'm utilizing the nurse educator on the unit, the nurse manager, working together to help train and educate the staff on the unit. Another factor for the nurse as being a leader is the charge nurse is the one that's going to be finding the nurse that's taking care of the patient that they're rounding on. If they're unable to find the nurse that's taking care of that patient at that time, then the charge nurse will be speaking for that nurse, giving the updates at the bedside with the providers of any issues or concerns that the nurse may have for that patient. So this is a big thing, and also to keep the consistency. And being a leader in the nursing field is important to have that positive attitude. Change is always difficult, and as a leader, it's important for us to be that positive, that role model for the other staff. Collaborative strategies. Oops, I want to go back. All right, collaborative strategies. The nurse educator will educate the staff along with the nurse manager. So there's going to be a lot of collaboration there. The attending physician who sets up medical students will educate the medical students. The medical director of the palliative hospice unit will educate the other attendings. There's going to be a committee that's set up with the medical director of the palliative hospice unit, the attendings, the nurse practitioner, social worker, pharmacist, nurse manager, and 2 nurses. At this committee, they will discuss and review the articles. They will critique the articles, look at the validity, credibility. They will choose the articles that they wish on continued reviewing, looking at strategies of ways we want to standardize interdisciplinary rounds on our unit. And we want to make sure it's going to fit our unit. Every unit's different, and we want to make sure it's going to fit our unit. The team will determine which articles, as I stated. They'll confirm and roll this out and address the guidelines to the staff. There will be an informal practice for the unit, which will include the attending, the nurse practitioner, social workers, and nurses. This change will be educated to the night and day nurses and evenings. The education will take place on all shifts to provide time for each staff member to be able to be educated. There's also going to be monthly meetings held for any questions or concerns that the staff may have. The big thing here is we want buy-in from the staff. If you don't have buy-in from the staff, you will not be able to initiate this, you will not be able to implement the program. So it's very important to get buy-in from the staff. And what's important about getting buy-in from the staff is to hear what they're thinking and to collaborate and work together, answer any questions or concerns. Another way the collaborative strategies is that the nurse manager will be supplying to the staff of all the evaluations from this implementation. The evaluation process is with SurveyMonkey that goes out to the staff that will be using the implementation of interdisciplinary rounds. This will be done 2 to 3 months after the start of it. This way we can evaluate the staff feelings on the interdisciplinary rounds. We also look at the event reporting system. This is where near misses or actual events take place on patients. We will see if there's an increase or decrease of these adverse events. If there's an increase, we'll have to relook and see what we're doing and how to change things. Another factor for evaluation is that we will send HCAHPS scores out. Through the hospital surveys that are sent out to families, and we will evaluate that to see if the patient and family satisfaction has gone up. So there's a lot of collaboration strategies that are going to be taking place in this initiation. We all must work together in order for this to work. Let's talk communication strategies. This is very important. The intervention will be communicated among the healthcare team, discussions will be held, and the work team will produce the structured initiative. There will be meetings held for the staff and education with questions and answers. It is important that everyone to speak up. And being transparent, I find, is a huge help. Letting the staff know what's really going on, how we're changing it, how we came about this change, who worked together to implement this change. And there will be meetings held on a monthly basis. Excuse me, I'm so sorry. For the staff for any questions. And also another thing is for communication, the nurse manager, nurse educator are always available for there's any questions, and via email. Email is a huge access to. If someone's unable to attend, if someone's on disability, they're able to watch that through their email. So the summary. I'm very excited about this implementation. I really feel, especially this whole talk about interprofessional collaboration, I find that's a huge thing that we need. And as an educator, I feel like it's very important to build that confidence up in students and in staff. It's important to do simulations to build up that confidence, where you have a case study and you have a simulator, working with the whole team, having attendings attend these simulations, having the nurse practitioners, the social worker, the pharmacist. This way, it's all on the table in a safe environment. So it's very important to practice these skills. Communication is a huge key to anything. Collaboration is the most important thing in the healthcare world. Collaboration among healthcare teams has proven to improve efficiency and effectiveness of care, improve staff satisfaction, improve patient satisfaction. And we all have the same goal. And this is what I tell staff now. We all have the same goal. Everyone has good intentions. But other people may have different ways of how we can improve the quality of care. So it's very important to collaborate. So that's about it. Here are my references. If you have any questions, please feel free to email me. I hope you guys enjoyed this presentation. Take care.